Good afternoon, everyone, and thank you for joining today's webinar, Coronavirus in the New Workplace. My name is Chris Pagan, and I'm the Marketing Manager at Qualified Staffing. Lately, we've had a lot of discussions internally on what the world will look like when businesses begin to open up again. And we've come to the conclusion that workplaces are going to have to be different for the foreseeable future. We've had a lot of discussions with our attorneys about the new rules, and it just made sense for us to pass on what we're learning to our clients and to other businesses in our local communities. We really believe that if we work together and we share information and best practices, we'll all be better off when we come out of this crisis. So thank you all for taking the time out of your day to join us. I'd also like to say a quick thank you to Drew Eckel and Farnham, as they've been fantastic to work with on this project. We actually approached them about a week and a half ago, maybe, and they were very eager to put this presentation together for us. And I know a lot of hard work went into this in a very short period of time. That said, I'd like to turn things over to Dan Niffen from Drew Eckel and Farnham. Dan?
Thank you, Chris. Hi, everybody. My name is Dan Niffen. I'm here with our partners in the Drew Eckel and Farnham Employment Law team, Megan Noble, Meredith Guerrero, and Neil Brunitz. And likewise, I'd like to thank Chris and Qualified Staffing. It's a pleasure to partner with them, a longtime client, and folks we really enjoy working with. And as he says, we're all obviously in a brand new world these days. I hope this finds all of you navigating that world safely. And we're all kind of here in the legal world, and as Chris says, in the staffing world, kind of being bombarded with questions and issues of how to handle all of this, how to handle not just our current workplace, but I think what we've all come to feel like is much more an evolving workplace, and what is very likely to be a new workplace in many respects. So what we want to do here for the next hour or so is to work through some scenarios that I'm sure are going to be familiar to every one of you. They track the kinds of questions and the kinds of issues that, again, we get, I would say on a daily basis, probably more like an hourly basis these days. And we'll walk you through those. But first, maybe just a few thoughts on kind of maybe the context that we're dealing with here, because I think that will help as we go through some of the scenarios and as we're trying to figure out day by day, how do we do this? I think kind of understanding the context of where we are right now really helps. Obviously, to say this is unprecedented is an understatement. The laws that we're going to be talking about here today and that we're dealing with were certainly never drafted with the pandemic in mind. And that's kind of our first clue. If you're struggling with trying to figure out who gets leave, what do we furlough folks, who do we test, some of the things we're going to talk about today, understand that everybody's a little bit starting from scratch in trying to figure out how these existing laws that we have and some of the ones that have literally just been passed in the last couple of weeks apply to all of this. The congressional action that we have seen take place in the last couple of weeks is nothing short of phenomenal. The legislation was passed obviously in a rush in an effort to address a developing crisis. And as a result, everybody has kind of been scrambling in these first few weeks to understand the legislation, understand its purposes. And we're just now, really just within the last week or two, have been seeing regulations and guidances from the Department of Labor, from the Equal Employment Opportunity Commission, from OSHA, from state boards and regulators that are putting a little meat on these bones, so to speak, and giving us some idea of where these are going. But as everybody I'm sure has seen, and we certainly see, there's hardly a day that goes by that we don't come into the office and discover a new wrinkle, a new regulation, a new guidance, a new something that gives us a better idea of how this is going to work. So most of you are familiar with some of the laws we're going to talk about that have been passed by Congress on a federal level to create paid leave laws that relate to coronavirus and expanded FMLA. Each of us in our individual states have had a variety of laws and executive orders that are a little bit of a starting place, I suppose, for us. Certainly as a business, your starting place for all of this state by state is, are you allowed to be open? Are you an essential business or not? And depending on where you are, you may or may not be able to really address a whole lot of employment issues because you may not need to be open. If you are, there's certain regulations that go on about that as well. But as we're going to see also with some of the laws that we're going to go through, some of them are state specific, certainly the workers' compensation laws. unemployment benefit procedures, and so forth. The context that we're in, I think, is simply that. It's new, it's changing, and it helps to bear in mind as we go through this that there's going to be a need for everybody to kind of pay attention. Very, very little of this is set in stone just yet. And I think it's helpful also to realize that we're probably, hopefully, just now coming to the end of what I would think of as the first phase of this. I think there will, in kind of a big picture mode, be 3 phases. If this is the first phase, the initial lockdown phase, let's say, for lack of a better term, hopefully we're coming out of that. The last phase is not going to come, by all accounts, until a vaccine for the virus is widely available. By all accounts, that's going to take at least a year, maybe 18 months. And where we're going to live and what we're going to be talking about primarily right now is the interim. What happens in between as we start ending the shelter in place, we start thinking about whether it's keeping folks at work or getting folks back to work. How do we do that safely? What are the employment law implications? And as employers, what are our obligations to do? So that's one context I think that's important to remember, is that things are going to shift. The rules that have been in effect for the initial lockdown are going to look a little different in a transition phase, and they're going to look a lot different, hopefully, once a vaccine is out there. But there's another thing I think that is true, or that we're seeing in looking at all of these initial laws, and that is very clearly what these laws are trying mostly to do, obviously, is promote safety. And we're going to see as we go through these scenarios that starting with that as your starting point, that how do we make our workplace safe? How do we keep our employees from being sick? How do we keep our clients or customers from being sick? Things tend to flow a little more easily with that as your starting point. Obviously, a great deal of legislation has also been passed specifically to help businesses monetarily and otherwise, and to help employees try to hold on through this initial phase. So I think to the extent we're trying to navigate through some gray areas, leaning towards, hey, let's do what's the safest approach. Let's do what we can to kind of hold on is what the laws are encouraging you to do. And then lastly, as both of these things indicate, the need to be flexible is simply crucial. The things we're going to talk about today, some hard and fast rules, but a lot of it's going to require being flexible as we go forward and rethinking kind of how we do our work, how we do our workplace. And again, I think we'll see that a little more as we go through the scenarios. So we'll jump into those right now. First scenario. Among our employees, we've had some who've been exposed to the virus, some who need to be home to care for a family member who's sick, and some who can't work just because schools are closed and they don't have daycare, and some who are healthy, but they don't want to come to work because they're afraid they're going to catch the virus if they do. So this is maybe the most typical question, I think, that we get asked. And as you see here, these are all slightly different situations. And as we're going to go through some of these scenarios, there are sometimes different answers for each one of these. But maybe the first question we started getting asked was, well, what can we do to kind of make our workplace safe in an existing workforce? Just can we go out in the plant right now? Can we have our nurse take everybody's temperature and make sure they're not sick, and maybe take their temperature as they come into work during the workday? Well, until all this began, the answer to that would have been no. Americans with Disabilities Act would say you can't ask any medical question or medical test of an existing employee without business necessity. But very quickly, when this began, the EEOC came out and said, no, taking temperatures of employees is absolutely fine. Where it gets a little murkier, and we'll talk about this in more detail, is kind of the second issue about being obligated to make sure your workplace is free of the virus and how much you can test employees. As we're going to see, there's a line, at least for right now, that I'm pretty sure is going to change as time goes by for reasons we'll talk about. But while it's very clear right now that you can take an employee's temperature, the EEOC has also said, and this would be different than the case before coronavirus, that it's fair game to ask employees if they have symptoms of the virus. For example, do you have a fever? Do you have a cough? Do you have symptoms that are typical of coronavirus? Those are fair game now, all from the notion that we need to keep our workplaces safe. But whether you can test, for example, somebody who shows no symptoms, who hasn't even necessarily been around somebody who's sick, that's more of an open question just now. And obviously, if you get into these scenarios, you immediately run into OSHA requirements. So let me hand it off to Neil here at this point, who can walk us through some of the OSHA issues with this scenario.
Sure. Thanks, Dan. And we're kind of continuing in scenario one here. And as you can see, one of the questions we get is obviously if one of our employees caught the coronavirus from a coworker, do I need to report that to OSHA? And we've taken a look at this question, and my answer to this question a week ago was completely different than my answer is now. And that's because OSHA issued some guidance on when and what needs to be reportable on the 300 logs for OSHA, and when it's a reportable illness. A week ago, I would have told you that OSHA says you have to perform a work-related analysis to determine whether the coworker caught it from a coworker, and in our instance, that's exactly what happened. That would have easily been reportable on a 300 log. It's becoming a little different because OSHA has relaxed the need for certain industries to conduct those work-related investigations to make it determined as to whether the coronavirus was caught because of work-related activity. They have exempted out healthcare, emergency services, first responders. They still have to always conduct this analysis, but if you are not in those categories, there's no presumption that it's work-related connection. And if, because of the amount of community-wide contact of COVID-19, there are certain instances where then it becomes your obligation to make a determine whether it's a work-related contact. And those are really just ones where you have some additional information that it was caught from a coworker. If you have a coworker or a worker that just shows up and has coronavirus, then that's not necessarily a 300 log reporting requirement. But if you've got some additional information that shows you've got and the example that OSHA gives is you've got a small group of employees who closely work together that all come down with coronavirus and are all diagnosed in quick succession without really any outside community involvement, that is likely going to be something where you have to make a determination whether it's work-related and therefore it becomes reportable on a 300 log. The random exposures that may be outside of work that don't have any particular tie to work, the guidance is those are not reportable at this time. Now, as Dan said in the intro, these things are going to change constantly, will continue to change. That has changed just from last week. So there could be further explanation and guidance from OSHA on how that works. The next on there was, can OSHA inspect you for coronavirus? And the answer is always OSHA can inspect you for anything. This is definitely one of them. And this is also an area where enforcement's changing. Actually, on the 13th, OSHA put out some guidance on what investigations are going to look like. In their investigations, typically someone would show up from OSHA, they'd give you a badge and show you who they were, show you their credentials, and they'd ask to sit down and have an opening conference with the facility about why they're there. That's going to be done more via phone and via fax. And some of you have probably gotten letters from OSHA asking you to respond to certain criteria. That's going to be more of a normal issue from now on. When OSHA wants to inspect a facility, they're probably going to place a phone call and set up a time because in addition to checking on worker safety, they accept that they have a duty to keep their own CSOs safe. And so they're struggling with how do they show up at a facility where they don't know the standards of how things are being handled. and potentially expose one of their own people to this as well. And they've actually issued pages and pages of guidance with about 16 different links to other references just a couple days ago about what that means and what it's going to look like. And in part of that, what they've gone to is what OSHA standards really apply. There is no uniform standard that applies to COVID-19. If you're in the state of California and you happen to be in the healthcare industry or a few other industries, California OSHA does have an aerosol transmittable disease standard that they enacted in 2009 that you can look at, and it is a pretty intense and pretty comprehensive game plan about how to deal with these type of diseases such as COVID-19. But if you're not in California, it is a California standard. OSHA does not have a comparable standards, as people probably know from dealing with OSHA. State standards can go higher, but not lower than OSHA. Most of us in most states don't deal with that kind of standard. But what comes important here are kind of the standards OSHA has identified. Obviously, personal protective equipment, hazard communication, job safety analysis, and then the general duty clause. And for those of you that don't remember the wording of the general duty clauses, OSHA requires that employers provide their employees a workplace free from recognized hazards likely to cause death or serious physical harm. When dealing with COVID-19, you can pick apart about 6 different words in that standard and how they might apply. So just as OSHA is kind of dealing with this, so is everybody else. So they're relying on standards such as the PPE standard, HAZCOM, job safety analysis. They've identified a couple additional ones that when they are doing inspections, they want to know about accident prevention signs. They want to know about access to medical records, and they want to know about eye and face protection. Also, the recording and reporting is going to be important when they start investigating. Going back to Dan's earlier point, I think one thing that's going to be a key when OSHA starts doing inspections and continues doing inspections with this in mind is a job safety analysis. Have you, as an employer, sat down and thought about what are the hazards involved with COVID-19 and how are we going to try and address them? Obviously, you're not going to be able to address, and I don't think OSHA would expect anybody to be able to address every single hazard that most have hadn't been identified perfectly. But in Dan's scenario, when you're sending a nurse out to take temperatures of people that you suspect may have been exposed, what analysis have you done to protect that nurse as they go out? Personal protective equipment, distances. What's the scenario that you've done? Are you doing this in a well-ventilated room? And those are the things that everyone has to start thinking of, because that's where OSHA is really going to come into this new scenario, is how are people dealing with this, and have they even thought about it? For those of you that have ever been through an OSHA inspection, I'm sorry, I've been through several, and they always want to ask, well, have you thought about this problem? If you know you have a problem, what have you thought about it, and what are you doing about it? Sometimes people have extensive plans about how they're going to deal with things and then don't follow those plans. That also becomes a problem. But that's where a job safety analysis comes into play. How are you going to handle jobs? And then kind of to merge into that, how is this going to change? What's OSHA going to look at? How's this going to change our workplace? I don't know if anybody out there has an infectious disease preparedness plan. There are such things. They do exist. There's a very detailed one in the California regulation and standard. But it is more of, what are you going to do? How do you prepare for these things? A lot of that comes down to, when something like this does happen, how do you identify it? How do you identify employees that are affected by it? What do you do to isolate? What do you do to prevent them from spreading this virus throughout the workforce. How are you protecting everyone else? It's about identification. It's about how you control exposure. And then, like everything else, it's about training and communication to your employees. That's the whole part of the preparedness plan. Part of that plan is also how you're going to control the exposure in the workplace. And a lot of us are seeing this now. You go to a grocery store, and they didn't have little tape 6-foot sections in the checkout line 2 months ago. They didn't have sneeze guards in front of the cashier. They didn't have someone wiping down carts with disinfectant wipes. These are the kind of controls, and I use grocery stores because we all go to them. We've all seen the changes that they've made. But these controls aren't going to be limited to grocery stores. This is how the workplace is going to have to regulate itself. Now, is it going to have to be like that all the time and say phase 3 of Dan's 3-phase plan? Maybe not. Is this something to get us through the second phase? Possibly. Who knows what a vaccine does for this, but for the foreseeable time being, until there is some bigger solution, these type of workplace controls are what OSHA is going to be looking at to make sure you're not extending the spread of COVID-19. The last thing I've identified on the slide is just the aerosol transmittable disease standard that's in California. If you want to look through about 60 pages of legislation in California, it is a good explanation, and it is a good standard on how to deal with these type of situations. However, I suspect it is incredibly expensive to do, which is probably why we don't have a federal OSHA standard, although I cannot make any guarantees that they may not move towards such a thing because of this.
Okay. Thanks, Neil. We also have gotten quite a few questions, not surprisingly, about workers' compensation and all of this. The first of which is usually can our employees recover workers' compensation if they're exposed to coronavirus at work? And again, I'll preface all of this by saying the answer could change significantly depending on what state you're in. Workers' comp laws are not federal, they're state by state. But many states, including Georgia, and I know a lot of you out there, your businesses are in Georgia, have a part of their workers' comp statute known as the occupational disease exclusion. And what that means is not that all diseases are excluded, but there is a very high standard of proof to recover for a disease that is alleged to have been contracted at work. And the way it works in Georgia, for example, is that you have to prove a lot more than simply that you got it at work. And actually, the standard of proof there is pretty high. But beyond that, even if you could prove that you, for example, got coronavirus at work, you would not be able to recover under Georgia's Workers' Compensation Act for an occupational disease if the disease itself, if the character of that disease is what the statute defines as an ordinary disease of life to which the general public is exposed. Now, nobody would say there's anything ordinary about coronavirus, but simply the lockdown procedures and the quarantines and all of the things that we're going through certainly make it clear that it is a disease of life to which the general public is exposed. So this is a great example of a law that was never drafted with the pandemic in mind. It was drafted, for example, to prevent things like the seasonal flu from turning into a few thousand workers' compensation claims. But that's a big hurdle in answering the question, are our employees going to get workers' comp? There are exceptions in many states under these types of statutes for healthcare workers, for example, or people who are first responders or who have a greater degree of exposure than the average worker. And in the states like Georgia, where that's not the case, I'd be more than a little surprised if there isn't a fair amount of consideration given to amending the law or changing the law in some way. And again, this gets back to that kind of primary motivation that we're all operating under right now, is we're trying our best to keep folks safe, to keep the virus from spreading, and certainly to take care of those folks who are on the front lines. So the short answer to the question is, in Georgia, for example, is an employee going to get workers' compensation for coronavirus? Probably not. but definitely stay tuned. Your state could be different, and Georgia could wind up going in a different direction somewhere down the road. And a similar question is, are we liable somehow to our employees if we have an unsafe workplace, if we bring them back to work and there's coronavirus there? That's where the exclusive remedy provision of the Workers' Compensation Act comes in. And where most folks get a little confused about this is they think, well, if my employee can't get comp benefits, for example, if it's not a compensable occupational disease, well, then they can sue me in tort. And that's not at all how it works. The exclusive remedy of workers' comp applies if the claim of your employee involves an injury that they claim came from the workplace. If that's their claim, then comp is their exclusive remedy. Whether they can recover there or whether they can recover comp or not is a separate question. And maybe a better way to think about this is if somebody gets hurt on your job and they're intoxicated and that's the cause of the injury, well, we know they can't get workers' comp because intoxication is a defense. But that would not mean that they could then turn around and sue you somehow under tort. Their remedy is comp. That's the exclusive way for them to go. So that's the answer. You're not going to be sued by your employees outside the comp system for exposure to coronavirus, assuming there's not something that is some type of exception to the exclusive remedy doctrine, and that involves very intentional conduct by the employer. If you deliberately expose somebody to coronavirus or something else very dangerous, then that's obviously a whole other ball of wax, but none of us are doing that. The other question is also tricky, which is, well, what about our customers? The exclusive remedy in workers' comp doesn't apply to them. And what are our obligations to make sure that a customer can say, well, you exposed me to coronavirus, I got it in your place of business, and now you owe me damages for all this? Well, this is a fairly familiar area of the law, which is simply the duty that you owe to your, again, varies very much by state, but your invitees, the folks who you invite to your place of business, and the best advice is, as Neil has alluded to, OSHA certainly is going to provide a whole variety of standards that would help define if you're doing those things, you're probably meeting your duty of care, but also the CDC guidelines, which I would imagine most, if not all of you, have taken some opportunity to look at. They're updated frequently. They talk all about, of course, the hygiene and social distancing and things of that nature. And I would say if you're doing those things, then you are very probably meeting your duty of care to your customers. So that would be the best advice and best practice for addressing that issue. All right, moving on to our next scenario. I'd be surprised to find any business who hasn't suffered a dramatic loss of revenue, maybe Amazon. And keep going. To keep going, we've had to furlough a number of employees. Can I require medical testing to screen for coronavirus? So this gets back to the testing issue that comes up in a couple of different contexts. And again, the starting point for that is, well, under what context and what kind of employee am I trying to test? When you're talking about folks coming back to work, that's a little different than just going out into the workplace where everybody's already there working and saying, okay, everybody step up for your coronavirus test. That's a little murky. What's not murky is that if somebody is sick and goes out with coronavirus and they want to come back to work, you can, under the Americans with Disabilities Act, under the Family Medical Leave Act, ask for a fitness for duty certification. And we know how that works, right? That is not getting somebody's entire medical file. That's just something from a physician saying, yes, this person is fit for duty. They can do the job that is required to be performed. So it's kind of a limited inquiry. You're not going to find out everything there is to find out about how well or how poorly they did with coronavirus, but you should be able to be satisfied that they're not contagious and that they're able to return to the workplace in a healthy fashion. As we said at the outset, the EOC has said it's okay to do some things like taking temperature and asking questions. But for now, at least, the ADA restrictions on business necessity and what you can ask existing employees, folks who have not taking a break, they're just out there working for you, is still in place. And again, this is an area we're going to need to be watching very closely, because as it becomes more important and as we have the capability to test employees and make sure that they're either not contagious, that is, they never got the coronavirus, or maybe that they did get it, but they now are past it and have antibodies and are immune to it. There's a lot out there in the newspapers these days where the whole notion of testing is of course a hot topic, and have seen more than a few articles suggesting that, it's the workplace that we really ought to be doing this, that they have the greatest mechanism for being able to test large numbers of people. Now, I don't know if that's true or not, or if that's the best way or not, but certainly if it goes that way, we're going to need some changes to our existing law about what we can and can't do with existing employees. So all that's really clear right now are answers for folks returning to work. If folks are coming back in and they've been sick, I think we can get a fitness for duty. If they haven't been sick, I don't think we can do much more than maybe do a temperature scan and ask them about symptoms. Ironically, if we're hiring brand new folks, that's a whole different category. As you know, under the Americans with Disabilities Act, we can ask medical questions as long as we do it at the right time, which is after we've made a conditional offer of employment, but before we put them to work. And as long as we're doing that for everybody and we're keeping that information confidential, then yeah, you can do that for new hires as well. So again, this whole medical testing issue is changing, has changed, and undoubtedly is going to change some more. But that's where we stand right now. As we've talked about briefly, medical privacy rules do limit the extent to which you can ask employees, and we've kind of talked about that. But Neil, are there other changes we might need to make to make sure we're in compliance with OSHA about all of that?
Yeah, and we got into that a little bit before in my discussion. Some of the the CDC recommendations obviously are important. OSHA refers to them quite frequently. OSHA has actually prepared its own guidance on preparing workplaces for COVID-19. It was published. It's out there on the internet. You can find it. It's a bunch of pages long, but it's got good information. And it talks about, as we've got on the slide, job hazard analysis to restrict transmission. They've identified where, just like the CDC, there are really three different groups, high, medium, and low risk groups regarding transmission. High would be places like healthcare facilities, grocery stores, things with considerable contact with the public. And then moving to medium to low risk groups. And they provide different scenarios of how to provide controls, administrative controls, when PPE is required, when PPE is needed, when it could be used based upon these different groups. So that's something that's useful on how the structure of a workforce is going to look in a workplace. And then again, they just refer to the infectious disease preparedness plan. How are you going to plan for this? How are you going to respond when it does happen the next time? And as it happens, as people come back to work.
Okay. One last element of our second scenario here, we also have allowed a large number of employees to telecommute to comply with social distancing and shelter-in-place requirements. If an employee has been sick, am I required to allow him to keep working from home as a reasonable accommodation? Well, this is every lawyer's favorite answer. It depends. Just like it has always depended on what constitutes a reasonable accommodation. Now, somebody who's been sick and is no longer sick, no, you're not obligated to continue to allow them to work from home just because you have. But let's say somebody is sick, or maybe they have some other medical condition, and they are asking you as a reasonable accommodation under the Americans with Disabilities Act to telecommute. That you're just back in the same reasonable accommodation analysis that we've always had, which includes at least a couple of things. Number one, it's not an affirmative action program. You're not required to go survey your employees and say, okay, who wants to telecommute, and tell us about any physical limitations that you might have that require that. Secondly, the employee has to ask for the accommodation, and just because they do, that requires you to enter into a good faith dialogue with them about that. It does not require you to give them the accommodation they've asked for necessarily. It requires you to give them, if necessary, a reasonable accommodation, and that might or might not be telecommuting. So again, that's going to be a case-by-case situation. I think all of us have realized that telecommuting is going to be even more prevalent than it's been. But be careful if somebody is trying to press you about, hey, I want you to keep letting me work at home because I'm still not feeling very well. That's probably not going to get through the reasonable accommodation and ADA analysis. And the last question we're getting is for folks who go out under the COVID rules, and we'll talk about this some more in the next couple of scenarios, do I have to bring them back to the same or equivalent position if they're out under FMLA? And the answer to that is simple, which is yes. The rules about that have not changed. If somebody's out on FMLA leave, they come back to the same or equivalent position. All right, with that, I'm going to turn it over to Megan and Meredith, who are going to take us through scenario 3.
Thanks, Dan. Shifting gears a little bit here, going kind of away from OSHA and some of the physical requirements to some of the new laws that just passed. I have to say, as an employment lawyer, it's been rather dizzying over the last couple of weeks to keep up with what's going on and what's coming down the pike with this stuff. We've been getting questions every day, and I'm sure you all have those questions as you're sitting here listening to this stuff. We've been fortunate to have some more guidance coming out, particularly from the Department of Labor recently, that's been helpful in answering and help filling in some of the gaps. But any law that comes in quickly is always going to be challenging, and that's kind of where we are at this point. But a little bit before we get in the scenario, let me just do a couple big picture things to mention here. The Families First Coronavirus Response Act basically established two types of new paid leave effective April 1. Now, anyone who's watched the news knows that paid leave has always been an issue. It's something that people have wanted and lobbied for and has never really happened. But this paid leave under the FFCRA is temporary. It only goes basically effective from April 1 through December 31st, 2020. We've gotten questions about how likely we think it is that it will be extended. I don't think so at this point, given the economic, just the sheer cost of what's going on. There's no way to predict it. I think eventually we'll probably get there. I don't think it's going to happen anytime soon. But for our purposes today, the laws that we're talking about are very short in time, April 1 through December 31st of this year. So let's talk a little bit about our person here. 2 weeks ago, one of your employees called in and said she would not be able to work for 10 days because she'd been diagnosed with COVID-19. Yesterday, she called in and said that she needs another 6 weeks off to care for her 11-year-old since his school is closed until the end of the year. Since I attended a webinar previously, I understand that I need to pay my employee for the time off when she was sick. I know her adult sister also lives with her at the house with her family, and I'm wondering why she can't just take care of her nephew so my employee can come back to work. I have some more questions about all of this. First question is, how much do I have to pay her? Under the Families First Coronavirus Response Act, basically two new types of paid leave. The Emergency Paid Sick Leave Act, or EPSL, or the Emergency Family Medical Leave Expansion Emergency Act, or EFMLEA. So many acronyms, none of them really roll off the tongue, so forgive me. Both types of leaves, though, do apply to employers with fewer than 500 employees. So anything related to FMLA is new for those of you who are smaller employers who are not normally having to deal with this. So this is kind of an unusual turn of events. As you may have already heard already, if an employee is experiencing one of basically 6 enumerated conditions, you're going to have to give them 2 weeks of emergency paid sick leave under the new law. And there are 5 conditions that have been enumerated specifically that would allow someone to get this type of leave. The first is if they're subject to a federal, state, local quarantine or isolation order relating to COVID. The second is advised by a healthcare provider to self-quarantine due to concerns relating to COVID. Third is if they have symptoms of COVID and we're awaiting diagnosis. Fourth is caring for an individual subject or advised to quarantine or self-isolate. And number 5, is caring for his or her son or daughter if their school or place of care has been closed or child care is unavailable due to COVID-19. There's a 6th factor they mentioned, which is vague and which has basically been interpreted as a catch-all, which says required to provide paid leave if an employee is experiencing any other substantially similar condition specified by the Secretary of Health and Human Services in consultation with the Secretary of Treasury and the Secretary of Labor. There's been nothing enumerated for that or specified for that as of this point. Maybe something will come down the pike. Right now, it's just something they're kind of leaving themselves wiggle room in case we have to deal with something else later, what it appears here. So with our current employee that we're dealing with, clearly she needs time to take care of herself. It deserves to be paid for the time off under the specific provisions of the Act. Basically, the 2 weeks are allowed as paid sick leave during a 2-week period for 80 hours for a full-time employee. The idea is that assuming they work 40 hours a week, they would be paid for those 2 weeks off. The part-time employee, they're entitled to receive pay for regularly scheduled hours for part-time employees over a 2-week period. Now, the kind of interesting thing about the distinction between the types of paid leave under these circumstances is they differentiate between if the employee is to take care of themselves or if they're taking care of someone else. Basically, if that employee themselves is sick or awaiting diagnosis or quarantined, The rate of pay is up to $511 a day, maxed out at $51.10 total for caring for themselves. And if they're staying home to care for a daughter or son because their school or daycare is closed, then they basically get paid a lower rate, up to a maximum of $200 a day for a maximum of $2,000. One clarification that came out from the Department of Labor on April 6th regarding the use of either leave is basically an employee is only entitled to paid leave for qualifying reason having to do with COVID that causes the employee to be unable to work, even though the employer has work or telework for them to perform. Basically, what that means is that it has to be that the employer is open and ready for business, but the employee can't work. That's when they're entitled to leave. They're not entitled to leave otherwise. They're basically, if the employer is open and has work for them to do, either there or remotely, that's different than if they are ill or caring for someone. So that's a clarification that wasn't obvious from the statute when it first came out. So we've talked about, obviously, her entitlement to the first 2 weeks of paid leave. The next question we want to deal with here is what type of documentation do you need from her in order to get reimbursed? I would suggest here, and this could be a very long topic, I would suggest the Department of Labor and the IRS have put out a lot of frequently asked questions and good information that's helpful on this. Generally speaking, under both Department of Labor and IRS, they will expect you to have some documentation, including the employee's name, the date the leave is requested, the qualifying reason and name of healthcare provider, basically something from them stating they were unable to work because of a qualifying reason. And if the son or daughter is incapable of taking care of themselves under 18, they've got to have a statement to that effect, as well as the name of the school or daycare where they're attending. And also, an interesting wrinkle is documentation indicating that no other suitable person is there to care for the child at home. The IRS adds one other level, which is if the child is over 14, they want some kind of attestation from people saying there's a reason why they need to care for the child. So there are slightly different requirements for both of them, but fundamentally, you are going to need to document something containing this information. There's not a lot of specification in it other than the things that you would expect. But the key thing for getting the tax credit or get reimbursed, which is everyone's concern, is you've got to maintain the documentation for 4 years and make the effort to maintain it. I would say with something like a quarantine order or something, you have the employee provide you with a copy of it and attach it to an email with this information, you should be good. We don't really know exactly how this is going to work. You're not supposed to send it in or verify it. You're just supposed to maintain it. So that's something to keep in mind. A question they ask here is, well, what about her sister? She's got someone at home who can take care of the child. The question we've been getting a lot is, well, that person is a stay-at-home spouse. Why can't that person take care of the child? Why do I have to pay the employee when their spouse is home and he or she doesn't have a job anyway? But basically, you have to have the employee attest that there's no one there who can care for the child other than him or her. So I think you're going to have to take the employee's statement at face value. And we're dealing with a lot of issues lately where my impression is that some employees are slightly trying to milk this a bit. Dan had talked earlier about people demanding telework arrangements where employers aren't obligated to do them. And I think some people will sometimes try to take the broadest possible interpretation of being able to care for somebody or not in order to qualify for the paid leave. Not casting aspersions, it's what we're hearing a lot from people. There seems to be a lot of, well, I don't know, I just don't feel comfortable, or kind of vague reasons, but that's really not enough to qualify here. You want to have documentation that you could show later on to explain the basis for it. So, when you seek a tax credit, which is supposed to be fully, refundable, you want to be able to substantiate it. In terms of whether you can require her to work intermittently while she is out caring for her son, anyone who's ever dealt with Family Medical Leave Act leave has dealt with a nightmare that is intermittent leave. It is one of the hardest and most challenging things for employers to track because it's extremely difficult, just generally under the best of circumstances. And those of you who aren't familiar with it, intermittent leave basically means leave that's taken in blocks. It could be as small as an hour, or it could be a half day, but basically whatever kind of the employer and the employee agree to there. So, but it has to be something that they can agree to under these circumstances, because basically the FMLA, the expansion of the FMLA we've been talking about doesn't apply to the other conditions for the FMLA. It applies only to, let me back that up a little bit. FMLA leave is available. Emergency FMLA leave relates to child care only. So child care is where you're going to be documenting this information. And if someone needs to be home, to stay home with their child, or you might be able to work out an intermittent leave circumstance under that. The new regulations specifically say that's an acceptable way to do it, and it makes sense. If you're not actually sick, but your kid's school is shut down, or your kid's not sick, it would make sense that intermittent leave would be available. You could go to the work site, you could go for home, whatever you and the employee could agree upon would work. But if you have, if you're sick or you're dealing with someone who's sick, clearly the purpose of the statute is to keep sick people out of the workplace. So you wouldn't want someone home caring for a sick relative and then going into the workplace back and forth. So intermittent leave, think about it as being only available under these circumstances, under the paid leave for child care reasons, child care and daycare reasons. One other quick question that I'll throw in there, just because we've gotten a lot of questions about the small business exemption. People got excited when they heard about this potentially as a way to get out of it. But I will say what we've seen since then is it's pretty limited, the circumstances that you can get it. Basically, it relates also only to the child care exemptions under the EFMLA. Or if leave is so drastic for a business under 50 employees that would jeopardize the viability of the business, cause the employer substantial risk, or basically the employer can't find other employees that are ready, willing, and qualified, then you can request an exemption from providing paid leave. If you want that kind of exemption, you'd have to write it down. Once again, the officer of the corporation actually is required to maintain the documentation also for 4 years to substantiate why you didn't grant the leave. I would caution people to make sure that if you don't grant leave, to document thoroughly why you didn't do it, so you have it somewhere if you're questioned about it later on. We don't know how long this is going to last or how it will all shake out. So I've never once gone to a scenario afterwards and said, well, I wish they had less documentation. Only they didn't have all this documentation explaining why they took these actions. Because a lot of times a good faith effort will go a long way if you're being caught on the carpet for something. So with that, I think I will turn it over to Meredith, who's going to address some issues relating to the Fair Labor Standards Act that we're seeing lately.
Thank you, Megan. And yes, I'm going to shift gears a little bit. And Megan's been talking about legislation that is brand new, whereas I'm going to be talking about legislation that's been around for quite a while. But as Dan mentioned earlier, this law was not created with a pandemic in mind. So you have to take everything you know about the Fair Labor Standards Act and apply it to the current climate and the current scenarios that all of you are dealing with. Scenario 4, we have had to make several changes to our normal operations due to coronavirus concerns. Several of our employees are now working remotely, and some are working a reduced schedule due to a slowdown in business. We are also considering either furloughs or layoffs, depending upon what happens with our business demands over the next few weeks. We are hearing from our clients that a lot of you are dealing with these type of issues right now. I'd say almost every workplace in America is dealing with this now. I'm primarily talking about what is required by the federal law, the Fair Labor Standards Act, but keep in mind that you may have state-specific wage and hour laws that you have to keep in mind as well. So just keep that in your mind when you're dealing with any of these laws, that you may have something that your specific state requires in addition to what the federal law requires. But the federal law is always the starting place. So the question is, what wage and hour concerns should we have with employees working remotely? A lot. You should have several concerns in mind. And we're going to kind of hit on the high points. Number one is you're probably all dealing with situations that you've never dealt with before, with employees working telecommuting, or even, they may be at the workplace, but they may be working in almost complete isolation. Whereas before, a lot of you had it very easy to know when your employees were actually working and when they weren't. Now you are trying to keep track of working time without necessarily seeing the employee doing the work. So one thing that's very important is to come up with ways that you can ensure that your non-exempt employees, and these are your employees that are getting paid by the hour, that they are recording and being paid for all of their work time. Now, non-exempt employees, I did say paid by the hour. You may have salaried employees who are non-exempt employees, but you also, any non-exempt employee, you need to be able to keep track of what they are actually working and make sure that they are getting paid for all of their work time. So you should remind your employees that they should not be working off the clock. But it's also a great time to go back over your wage and hour policies to make sure that you are doing everything you can to keep accurate time records for your employees and to make sure that you are communicating very clearly with your employees what you expect them to do as far as recording their work time and submitting that to be paid for it. You, as best you can, you need to look at your systems and see if there's a way that you can actually monitor when your employees are working. And you should also, your supervisors should be keeping track of productivity because you know, it's important right now that your employees can stay productive, that you're actually, you know, getting what you're paying for from your employees. So, you know, you need to be careful monitoring that and speaking with employees about any issues. Now, just keep in mind that the Fair Labor Standards Act requires employees to be paid for time that they are working. So even if you are having doubts about whether they're working or not, it's best to err on the side of caution and pay those employees for the time that they're working, but address separately any concerns you have about productivity. And, you know, going forward, if you discover issues, you want to address that going forward, not necessarily retroactively, because you know, that's a Fair Labor Standards Act is a law that's not very forgiving to employers. So it's better to err on the side of paying employees for any time that they work and dealing with productivity separately. What wage and hour concerns should we have in responding to slowdowns in business? Generally, your exempt employees, they are entitled to their entire weekly salary if they perform any work during the work week. If they're ready, able, willing to work, and they work during the work week, then they are entitled to receive that full salary. That's the benefit to an employee of being an exempt employee, that, you know, sometimes you work less than 40 hours, sometimes you work more than 40 hours. But just keep in mind, you do not want to deduct pay from exempt employees' salary because you may cause yourself to lose that exemption, and you don't lose it for just that employee. You would lose that exemption for any employees in the same job classification. So it's very important to not make improper deductions from exempt employee pay. And this is a little easier with non-exempt employees because they are just entitled to time that they actually pay for time that they actually spend working. So that's where you keep track of hours and pay them based on the work time. But exempt employees, you do not want to make deductions from pay. One question that we are getting a lot is with slowdowns in business, where you have exempt employees, and generally exempt employees tend to be higher paid employees. So we have a lot of clients that are looking at, you know, I have these exempt employees that I have to pay a full weekly salary for, but they're not doing a full week's worth of work anymore because we've had such a slowdown in business. How do we address that? Like I said, you don't want to take that, you don't want to deduct from an exempt employee's pay improperly. So one thing a lot of employers are looking at is switching exempt salaried employees over to hourly employees. And generally, the Department of Labor has said that that's okay to do so long as the employer can demonstrate that they're not doing it for some improper purpose or to subvert the wage and hour laws. So when you're making these kinds of decisions, you just want to make sure that you can document that you're doing it because of business necessity or slowdown in business. I think, you know, the Department of Labor is probably going to be forgiving in a time period such as this because it's understandable that so many employers are struggling with just being able to stay in business and keep paying their employees at all. Just make sure, like Megan said, it's always good to document when you can. And you don't want to make any switch retroactively. You've got to communicate that to the employee. If you're switching them from an exempt salary to an hourly position or hourly pay, you want to make sure that's clearly communicated to them of when that's taking effect. Generally good to start that at the beginning of a work week so you're not changing in the middle and possibly improperly deducting from an exempt employee pay. And just clearly communicate to them what you expect going forward once they are switched from exempt salary to an hourly employee. Because the big change is they're going to have to start keeping track of their time, just like all of your other hourly employees. And that's something that exempt employees generally aren't used to doing. So you want to make sure that they're trained on how do you keep track of your time, how do you submit time records, to make sure that you're paid correctly. So just make sure that you clearly communicate to them what you expect from them going forward. So what can an employer do if they can no longer afford to keep everyone employed? A lot of employers are considering furloughs versus layoffs. Furloughs basically means that you are temporarily releasing the employee from work. You just don't have work for them right now. Whereas the layoff is usually, a complete end to the employment because you don't foresee that you're going to be able to bring that employee back to work. Can you require your employees to use their paid time off if you are placing them on a furlough? You can do that, so long as they're not falling under some kind of paid leave under the law that Megan was discussing, the emergency paid sick leave or the emergency FMLA. If they're not already taking leave under one of those laws and it's just a straight furlough, you can require them to use their PTO during that furlough. And a lot of employees probably will want to do that so that they can get paid during the time that they're not working. And then finally, if you are furloughing or laying off employees, reducing their hours, keep in mind any state unemployment laws, rules. Here in Georgia, we have an emergency rule in place that actually is requiring employers to submit unemployment benefit claims on behalf of employees if their work hours have been reduced or if they've been laid off due to a lack of work due to coronavirus. So keep in mind what your state requires you to do, but generally, I think employees that are furloughed or their time, their working time is cut back, they probably will be eligible for some sort of unemployment benefits, and just communicate with your employees about that.
Okay, thanks, Meredith. And that's all of our time today. I realize this is an awful lot of ground to cover, and actually we've tried to be a little bit specific, and not there's a great deal more we actually could cover. Obviously, if you get to some of the small business loans and some of the other legislation that's come out recently, but we certainly hope this has been helpful and appreciate your time and attention. I want to call your attention to one other thing as we wrap up here. You will be given the opportunity, and we hope you'll take advantage of it, to both review the program and provide your comments, but also to ask us any questions that you might have if there are some that we haven't addressed and that we could be helpful on. There'll be a couple of ways you can do that. We'll be happy to review them and get back to you with those. And then obviously, the whole reason we're here is to help. So to the extent you have questions or we can be helpful in thinking through these things with you and not just complying with the law, but achieving your overall business objectives, we're more than happy to do it. And I want to, again, say a very special thanks to Chris and Qualified Staffing for allowing us to partner with them with the webinar today. Thanks very much, Chris.
Thanks, Dan, and thanks to your team as well. We really appreciate your help. On behalf of Qualified Staffing, I'd like to thank everybody for joining us today. Please reach out to us if we can help you in any other way. And other than that, have a great day, everyone.